Hi there. My name is Dr. J. Michael Bennett. I'm with the Fondren Orthopedic Group. I'm a fellowship-trained sports medicine physician with my certificate of added qualification in sports medicine. We primarily treat shoulder, elbow, and knees. Today we're going to talk a little bit about one of the big questions we get often asked in our clinic, and a lot of you out there may have some questions as well regarding it. First off, when you're told that you have an ACL tear, that's pretty big news, and a lot of you don't know really what to do or even what to think at that point. But the first thing that your doctor should go over with you is really give you options in regards to graft preference. And the big part of the ACL reconstruction is basically taking a torn anterior cruciate ligament and giving you a new anterior cruciate ligament. And there are different ways of doing that, and there are different grafts that you can choose. And a lot of doctors have their own preferences, but I'll just say how we do things here. A lot of what determines what type of graft we use here depends on the age of the patient, activity status, and then basically just patient's preference as well, depending on whether or not they're okay with receiving a little bit larger incision or smaller incision, or whether or not they want a stronger graft overall. So basically, the way we break it down, if you're a young active individual, say less than maybe 30 years of age, in their late 20s or so, and you have an ACL tear and you want to go back to playing high contact, cutting, twisting, pivoting types of sports and activities, the strongest graft that we usually offer and with the best outcomes in a long-term, per long-term studies, is the patella tendon autograft, and autograft means it's coming from your own knee. Okay, it's auto for yours, and graft is obviously for the graft, but it is coming from the patella tendon. So if you look at the knee anatomy, and you look at your knee here, this is the quadriceps of the knee, this is the patella tendon here, and the patella here, and here's your patella tendon, and it inserts right here in the tibia tubercle. And usually what we do is we harvest the central third of that tendon. So that way you have a bone plug on either side. So you basically take a little saw and you take a little plug of patella, and you take the central third of the tendon, and you take a plug of the tibia here. And then after that, we usually close the defect, okay? And with each plug, it gives you very good bone integration. So when you're doing an ACL reconstruction, you're drilling 2 holes, one in the femur, then one in the tibia, and you're passing a graft through those holes, and you're fixating them on either side. And typically the graft will look something like this. This is just a plastic model, but it shows you the patella tendon or the patella bone and the tibial bone, and then the central third of the graft. And then you fixate it on either side with whatever doctor's preferences. Usually we use a screw of some sort, and it can be either metal or it can be absorbable. And you fixate it on either side. Now, and this is what the graft looks like with the little drill holes in the pull string. Now, another graft that's a very popular graft is the hamstring graft. Now, one of the big differences between the patella tendon and the hamstring is that the patella tendon has bone on either side, and the hamstring grafts are just soft tissue. And so the hamstring grafts are the central third of the tendinous portion of the 2 hamstrings here, which is the semitendinosus and the gracilis, okay? And basically it's a smaller incision too than the patella tendon, and it's usually on the distal aspect, slightly medial. And we make a small incision here, and we go and we just harvest the hamstring tendon. Now, when you think of hamstring, a lot of people think it's up in the muscle belly hamstring. That's not true. It's just the tendinous portion of those 2 hamstrings. And once you harvest those hamstrings, this will heal, and you will return to activities as tolerated once that is healed up. So you can actually sacrifice these 2 hamstrings in order to get a good graft. And another benefit of that is that it is, once again, autograft. The big difference between the two is patella tendon gives you bone to bone ingrowth, because you got a plug here of bone growing to the femur, which is bone to bone, whereas the hamstring is going to be tendon to bone ingrowth. So the fixation is going to be a little bit different for the hamstring. What we usually use is something called an endo button, or a button that we actually put around the hamstring. It's like a little anchor here. We pass the graft through, the graft gets embedded into this little socket here, and then there's a little button on the outside that kind of locks it into place in the outer cortex. And then over on this side, we have a screw actually that fixates it here. So typically the hamstring incision is usually maybe a couple of it, maybe 1 to 2 inches, 1.5 inches. The patella tendon incision usually goes from the inferior pole patella down to the tibia tubercle. So it goes about, it's a little bit larger incision for the patella tendon. So if cosmetics are an issue for you, you don't want a scar or a large scar on your kneecap, then the hamstring may be a more valuable option if you're a younger player that wants to get back to those cutting, twisting, pivoting types of sports. Because once again, the autograft shows better incorporation overall, especially in that younger active population than say an allograft. So we've talked about patella tendon, we've talked about hamstrings. And now the third type of graft that you're going to read about and hear about is something called an allograft. And that means it comes from a third party, it comes from a donor. So you can actually get any of these tendons from a donor. You can get a patella tendon allograft, you can get a hamstring allograft, or you can even get an Achilles allograft, which some doctors will use as well, because it's a very robust tendon with a single bone plug on one side. And so the Achilles works really well as well fixation wise, but it is an allograft. So that being said, that's not your tissue. So that tissue actually is from a donor. It gets sent off, it gets sterilized and prepared, and then we basically use that as a graft substitute. The problem with some of these allografts is that the studies have shown that there is a slightly higher failure rate in very young patients who participate in a lot of these cutting, twisting, pivoting sports and activities. So usually I start mentioning allograft as an option to some of my older patients that are usually 30 years and up, and maybe want to go just do some recreational ball or just want to play with their kids. They're not necessarily out there every weekend competing, either in pro football, collegiate football, any kind of pro collegiate sports or activities. Usually it's for the weekend warriors, it's a good option. But it is an option nonetheless. And the benefit with the allograft is that you're not harvesting anything from yourself. That way you're not really necessarily taking any bone from your patella or taking your hamstring. You get to keep all your own tissue, and you're using tissue from a third party. But that being said, once again, it may take a little bit longer time for your cells to populate that allograft, because that allograft is basically a blank slate. It's like a scaffold of collagen that we put into the knee, and then your cells will over time populate that scaffold, and it becomes a part of you over time. So in the end, typically the recovery phase in the postoperative course usually is about the same in the end when you're looking at returning to high contact cutting, twisting, pivoting activities, and it's anywhere from 6 months, sometimes up to a year, depending on your type of therapy and your recovery, and everybody's a little bit different regarding that. But that's really just some basic information regarding graft options, and it's something that you should talk about with your doctors when you're deciding to do an ACL. You got to know the different types of grafts that are out there and which one is best suited for you. So if you have any other questions, please go to our website or please call us at the office at 281-633-8600. Thank you.